if your child isn't following directions, it's generally because of one of two things. Either they don't understand them, or they understand and choose not to follow them. The first issue is the topic of this video. The second is also very interesting and will be the topic of a different one. But for those children who don't yet follow directions because they can't, meaning it's evident that their ability to process what they hear and match it with the corresponding action is not there yet. So usually you're talking about the recently diagnosed 1.5 to 2.5 years old toddler who has autism spectrum disorder and maybe even had been following some instructions before, and then those skills deteriorated until you had a clear impediment. So that's where you are as far as when you teach a child to follow directions based on what you say. In this case, we're talking about specifically the young child that's learning basic following direction skills. The format generally that works is such where you're sitting across from each other and you're at eye level. Usually this means that the child is going to be on a child-sized chair and you'll be kneeling on the floor in front of them. This tends to be the most comfortable for both, and it makes it easier for the child to pay attention to your verbal and nonverbal language as you provide your directions, which then they have to decipher to match with the corresponding action. As far as the actual instructions that you're going to teach and in what order to teach them, you want to start with instructions that are easier, basically. So if I say something like high five, and that's my instruction for the child to raise his or her hand and tap it with mine, then that would be easier than me saying touch your nose without me doing anything. So start with instructions that require some type of, or include, I should say, some type of embedded prompting or cueing visually. Or give me a hug, and you open your arms. That would be an example of a cued auditory instruction. Start with those and then move up eventually away from those until you're just saying these instructions without any type of visual cue, and you have the child successfully follow them. So at the beginning, you will find that because most often, you don't yet have imitation skills, you're going to rely heavily on physical guidance. So just make sure that as far as the teaching structure, when you're teaching a child to follow directions, as you're seated across from them, immediately after you say the thing you want them to do, especially in the beginning, provide the physical guidance for them to do the thing that you're asking them to do, so that the association is made much more clearly because it happens close together in time. The time between I said the instruction and you made the motion to clap because I said clap your hands, and then I'm prompting you to do this. The less time it takes between these two things, the less repetitions of this routine your brain is going to need to start owning that association, and then you have to practice and review, but your brain has to recognize what you're trying to tell it. And in this case, you're trying to tell it that when I say the word clap, you're going to move your hands in this motion. So I need to make sure, as a therapist, as the parent that's teaching this, that these two happen as closely as possible. So at first it takes a lot of guidance. With time, you fade that out until you get your independent responses. That's it generally. Please take a look at the post for more detailed description of this. We will be posting these for different types of skills, or many types of skills at many types of levels. Do make comments if there's any particular skills that you would like me to demonstrate. These come from our experience or my experience over a couple of decades of designing and implementing, delivering these interventions at all types of levels in all kinds of environments. So the purpose here is to provide you with the roadmap. So if you have a little one diagnosed in the spectrum, you can get going with the things you need to do, and at the very least have a good idea of what to teach and when. Make sure you visit. We have more videos on the YouTube channel, and see you on the next one.